So a brief introduction to Chestnut before we get into more of the content is that Chestnut is a non-for-profit. We provide behavioral health and primary health care. We do treatment for substance use disorders for adults and adolescents, mental health counseling, primary health care, credit counseling, prevention. We are a leader in evidence-based research, located in Illinois and Missouri. Joining me today is Paul Cook and Kristin Grant. Kristin, could you go ahead and introduce yourself?
Absolutely. Thank you, Alison. I'm Kristin Grant. I've been a community health specialist with Chestnut Health Systems for over 6 years. I also have a daughter that's about to turn 21 this summer. So I took advantage of some time in the car yesterday to talk to her a little bit about responsibility and alcohol, right? So I really like helping youth learn healthy ways to manage stress and making good decisions. I enjoy giving community presentations about alcohol, tobacco, and other drugs. And today our conversation will be about opioids, and it's going to include a very personal story from Paul. So if you're watching us today, please practice self-care. These topics might bring up some feelings and personal triggers. If you or a loved one would like an assessment or need help, information will be entered into the chat on Facebook.
All right, thank you, Kristin. And Paul, you can introduce yourself. Now, no offense, but I believe Paul is the main attraction. No offense to Kristin, but could you just give us a brief introduce yourself, Paul?
Well, thank you very much, Alison. And Kristin, I think you're the main attraction. I'm sorry. I'm just going to go ahead and say it. Chestnut Health, main attraction. I'm Paul Cook. I am first and foremost the dad of 2 daughters, 15 and 18 years old, getting ready for college, and all the anxieties of now. I know we'll get into that, but that's a big challenge. And I kind of started my whole process of, well, pretty much being obsessed with recovery and finding solutions to that risky behavior for about 18 years when I had my last drink. I'm also a sober coach, which is just an incredibly rewarding thing that I get to do, and a broadcaster. I've worked all over the country, in Los Angeles, up north, DeKalb. Maybe some people know where that is, DeKalb, Illinois, and near Chicago, and in St. Louis for the last like 20 years on what we call a hot AC kind of fun station called Y98. But this is truly my passion. So I'm so grateful to you guys for helping me get the word out as well, or me getting to help you.
Yes, we really appreciate that too. This week is SAMHSA's National Prevention Week, and SAMHSA stands for Substance Abuse and Mental Health Services Administration. No wonder we call it SAMHSA. Their mission is to reduce the impact of substance abuse and mental illness on America's communities. Each year around National Prevention Week, communities and organizations across the country come together to raise awareness about the importance of substance use prevention and positive mental health. The topic that we're going to talk about today is opioid drug use. Before we get started with the questions, I want everyone to understand that although we are talking about opioid use in teens today, teenage opioid use compared to other teenage substance use, like compared to alcohol or compared to marijuana or compared to nicotine, the numbers are low. However, statistics say that 2 out of 3 adults treated for an opioid use disorder first used opioids when they were younger than the age of 25. So we think that even one teen misusing an opioid is too many, and which is why we brought this as a topic for parents. So first question to Kristin. First of all, what is an opioid use disorder?
An opioid use disorder, or OUD, is a physical and mental dependence on opioids. Opioids are found in many prescription pain medications, and they're also found in illegal substances like heroin. Opioids reduce or block the pain signals from the brain, and we know that use of prescription painkillers long-term may lead to the drug becoming less effective. That's due to developing a tolerance. The body can develop a dependence, and people might just need the drug, the opioid, to feel normal or to not feel sick. So some people feel a euphoria or rush because those drugs not only block pain, but they're engaging the reward center of the brain. So misuse of medication can happen because people like that feeling and they want to feel that way again, and even to intensify that high feeling. This is misuse as it was prescribed to alleviate pain. Soon the drug becomes less effective at blocking pain or bringing on the high, and the person needs more or uses more often. So that's noticed in withdrawal symptoms. That's when a person with a substance use disorder, if they stop using the drug or if they haven't had it in their system, their symptoms might be uncontrollable cravings for their drug, an anxiety, nausea, and pain. Addiction, or like we say, substance use disorder, begins when daily life is hijacked by a cycle of substance use and withdrawal.
Thank you, Kristin. So Paul, people may know your face, more people may know your voice. I don't know how many people know your story. So if you could please tell us your story.
Well, thank you guys for having me. It's just really an honor, and thank you for whoever's watching the Facebook Live or the replay. I'm right there with you. I'll be watching again as well, just to see how we all looked. But yeah, I'll tell you my story a little bit. At 23, I had my wisdom teeth taken out. Before that, there had been some underage drinking in high school and college. This was right after college. And I remember that feeling on that day. The orthodontist or ortho surgeon gave us, I think, like 30 oxycodone. And I remember taking that pill for the first time, and it didn't feel like when I drank. I actually started laughing. And I thought subconsciously, I'd like to live as many moments as I can like this, not knowing like we should today, those dangers. I do even remember my mom saying, I think you're liking that too much, and that was very, she really had a great impulse there, but, we just didn't know. We didn't know like we probably should have. So there was some of that was kind of like a enticement there, but I never refilled that prescription, which is pretty important. But then I went through the craziest series of kidney stones and the trials of Job, having them like every 2 months at that age. And with that, of course, became a lot of pain medication being prescribed. And they always compare it to pregnancy. I think pregnancy is probably still, giving birth is still worse, but there was a lot of that. And there was even the thinking, which I don't know if it's totally wrong, but wrong for me, that you need to get in front of the pain. If you feel a little bit of this, Paul, in your lower back, get in front of it. So that kind of gave me the, I guess, license in my own head to take more and take it when I maybe wasn't even feeling pain. And that's when, a great definition, Kristin, the tolerance started. And it was like, it's such an interesting thing, because you don't say, I want to get high. I mean, there is that, but it's like you said, the reward center of the brain, you're just craving it, And at that time I was going on the radio for the first time and doing this. And I had so much anxiety about that. I always felt if I did take a pill, I didn't feel as much. I felt like I was better on the radio, which was bad. When you listen back, I really wasn't, but I felt that way. So that's kind of my story, where I would say that opioids are my drug of choice. When we always kind of say, and you guys can speak to that maybe a little later, that we say drug of choice, like there is, I believe, one drug or substance that would be a drug of choice for anyone. And hopefully you're not out there seeking to find it, because opioids make my dad nauseous, or right. My mom overly tired, and my wife too. So I found my drug of choice that made me feel more creative, more elevated, less stress, even though it created all that, as we went on. So that's me in a nutshell.
Yeah, I do think that's interesting, because I've had opioids prescribed to me before. If you have any sort of surgery, you have those prescribed. The first time I ever took one, I felt nauseous. I was like, oh, who would ever want this? So then I've had other surgeries since then, and it was like getting in front of the pain. And so you don't want to feel pain. You really don't. But at the same time, that's a part of having surgery or whatever thing that is going on. So, you have to be aware of how that's making you feel. And it's interesting to me how it can react differently in different people.
Mm-hmm.
For some people, it's the best time their best feeling they've ever had.
Mm-hmm.
And so then they're chasing that feeling again and again. So you also said that you had started with some alcohol use as well. Was there alcohol use within the opioid use as well?
Good question. There was a tinkering, trying that out. I found it just really almost knocked me out and made me tired and cut into that elevation of the opiate. And then I see people dying, or having horrible reactions. So I kind of got away from it pretty quick, but there definitely was some of that.
Yeah. So when did you realize that this was a problem that you had?
Yeah, I almost think my body realized it and my subconscious realized it pretty early on in those kidney stones. Well, of course, I thought it could be a problem. And then I didn't believe it, I have kidney stones, this was my big thing. But when I had my mind saying, okay, I'm at my friend's house hanging out and I want to look in the bathroom cabinet, that impulse really hurt me. I hated that, but that said, boy, you got a problem here that you would, look in their medicine cabinet potentially. And that was like, ugh, that was it.
Right. Yeah. And it's so good that you were able to recognize that at that point, that you were able to realize that you were having a problem. This was something you were dependent on.
Yeah.
So many families think that this is something that won't happen to me. This won't happen to my family for whatever reason it is. Maybe they feel like, okay, we don't have substance use disorder in our family. We're a close family or something like that. Could you explain a little bit about your family growing up and that family at that time in your life?
Yes, incredibly tight family. We were a tennis family. We still are. They all played tennis. My sister was a great state champion tennis player. I wasn't quite as good, but a lot of athletics, a lot of playing doubles together. It was just four of us, close with extended family. And, we had all the opportunity you could imagine and a lot of love. And I'm pretty sure if you asked my parents back then, and you said, you sat it down, you had a big seminar with my parents sitting in the crowd. This is dangerous and this could happen to you and could lead to heroin. My parents would be like, oh, this one's not for me, not Paul. That's not Paul. Student council, athlete, fun, and seems to be high on life no matter what. But it just, boom, it can happen so quickly. So yeah, that's a great myth to kind of dispel that not my kid, it just doesn't discriminate.
Right. That's a very important. It doesn't discriminate. It can happen to any race, any gender, any person. It can be the star football player. It can be, the valedictorian. It doesn't.
Yeah.
There's just no boundaries.
And it does.
How this can affect people. So yeah, so that's important. I also think it's important for, if there's a family going through this, to be able to feel like you can talk about it, because there's no shame in this. Like, it's, it happened. It's nothing that you did as a parent or anything that you did as a family that caused this to happen.
Absolutely, Alison, definitely.
Yeah.
That is so important, because that shame, that stigma keeps us kind of in a closet on it. I hope things like this, it's a huge mission of mine to try to break that stigma of not sharing. I mean, it's a medical condition that happens no matter what you think. It's the body and the brain, so I know. I think sometimes we think, if I just had raised them better on this, or more goal-oriented, or even more awareness sometimes isn't enough. It's when you're in it and you are addicted or you're really having a problem with it, those things are kind of like not even thought about. You don't think I'm going to disappoint my parents or this, that. It's an interesting thing where it does take over the brain in a way,
Right.
and get you on that other line of thinking, which is so dangerous.
Right. Okay, so how could family or parents influence substance misuse? Kristin, what do you think about that?
Well, family can be a huge influence. And we've been talking about how drug misuse does not discriminate. It could happen to my family. It could, we're prevention specialists, we're community health specialists. It can happen in our families. Just talking to youth about anything is going to provide a protective factor. The more protective factors students have, youth have in their lives. So if they know good decision-making skills, if they are practicing stress management strategies that are healthy, right? So talking to youth about the effects of medication and reasons to take it and to stop taking it are an important step. But just any communication. I suggest that parents should lock up all pain medications safely in a secure location. Paul was mentioning that he had thoughts of looking through a cabinet at a friend's house. So if any parent has that locked up and put away where youth aren't able to access it, or anyone coming in your home aren't able to access it, we're preventing others from misusing medication, right? So lock boxes are available for purchase everywhere. Most major pharmacies and online retailers sell lock boxes. They can be small single pill bottle caps, or they can be larger to contain more medications if a family uses lots of prescriptions, right? Too much of an opioid, whether it's heroin or a prescription, can cause an overdose or even death. That's why even older teens need to be monitored when they're prescribed a medication. So if they're prescribed a medication for a wisdom tooth or a sports injury, talk to the doctor with the youth and understand what is a proper dose, when should they take it, when should they stop taking it, do they really need a 30-day supply if they have their wisdom teeth out? Ask questions of your doctor with the youth there so that they understand and start developing those good habits early on. Thanks.
Yeah, I think all of that's great. And I also, some things just to add, as I think about how, when your kids were toddlers, you locked up you made sure there was child locks on the chemicals and all those kind of things. I used to keep the medicine on top of the refrigerator. Well, now my son is taller than me. So, that's not going to work anymore. Like, you need to put it in other places. And I also think that being a good example is important. When my kids were younger, I loved ibuprofen. Oh, you can't sleep? Ibuprofen. Oh, you have a toothache? Ibuprofen. Now I'm like, okay, when they come to me and they say, oh, I have a headache, I say, oh, drink some water. And I know that ibuprofen is like, it is a medicine. It's not going to hurt you necessarily, but like, it just be a good model on medication. Medication should not rule what you do. So, and so like, there's other things, drink water, take a nap, take a walk or whatever. And also for sure, doing healthy mental health things, like do not, do things for yourself, take a walk, that sort of thing as well. A question that came in from the comments on Facebook from the chat: at what age is it appropriate to discuss opioid misuse with your child?
Kristin, you take that one. I'll respond too.
Okay, so I think that, when they're old enough to start understanding what no means and what, dangerous means, or those types of things. Certainly those things should be up high, out of reach. Like you said, Alison, we store our dangerous chemicals out of the reach of toddlers. We lock our cabinets when they're young. Why don't we do that when they're older? So I think that you can start having those conversations in really simple ways and just incorporate them into life. Like, this is mommy's medicine. My daughter grew up in a household where my husband took daily insulin shots. He was a type 1 diabetic, and she knew not to touch his insulin and not to touch his needle supplies and things like that. But he also kept them safely up high away from her. But we had conversations at really early age about what the medication was for, why he took it and why she wouldn't take it. So I think those are important at young ages. And then at older ages, you know, what is responsible? What do we expect in a household? You can start that before 5th grade, because studies show that some students start engaging in or experimenting with alcohol, tobacco, vaping, things like that at earlier ages nowadays. So it's important to have those conversations about what your expectations are. We expect that there are no substances used by people in this household. Be a good role model. Make sure your family understands that, you know, you're not out there doing things that are going to cause harm to your body or are going to cause you to be acting in an unsafe manner either.
Yeah, I think that is brilliant guidance right there. And I just want to say ditto. No, I'm gonna add on to that. You're so right. A great parallel is that locking up, putting the thing on the doors with the toddler. That's exactly right. And you're helping your toddler when you do that, right? Well, when you do have a lockbox for your opiates and other medications, you're helping. You're not saying I don't trust. You are helping them. And you're helping a friend who comes over when you're at work with them, you know, their friend, you are helping. So I think that is so important. And maybe you're also, as a parent, what I tell my parents that I talk to is, you're having the opioid conversation when they're very young and you're just saying, we don't take other people's medication. You know, some people do require medication, insulin, or even a pill of some kind. It is so wrong to take someone else's. It could hurt you. And, you know, boom, you're starting that opioid conversation right there.
Right. And that's true. It doesn't have to be an opioid. Like it, you know, any sort of prescription medication you do not take if it's, and explain that to them as well. And also, you know, we've talked about teens being prescribed opioids. That doesn't mean they get control of that bottle. Like you know, if they have an injury, they have the wisdom teeth, whatever it is, you can still have, as a parent, have control over when they take that. Like you know, make sure that, you know, they're only taking it when they're supposed to, but they have to say something to you. So at least you as a parent know also, okay, my child is in pain. My child's still in pain after, you know, 2 weeks. I don't know if they should be in pain. I should call the doctor. You know, all those kinds of things. Don't, like, just because your child might be old enough to have their own opioid prescription doesn't mean you just leave it on the counter for them to take when they want. So you know, you still need to be in control of that, I think.
That's engaged parenting. You know, you're engaged there in that process. I love that about, well, why are you still in pain? Why are you still asking for this? Again, you're helping the kid.
Right. I would agree. I don't think there is I think there isn't a too young age to talking about taking medications properly. And going along with what Kristin said, like, you as a parent may take medicines and they may see you take medicines, but say like, no, this is for high blood pressure. This is why I'm taking this. This is, you know, for depression. And because, you know, there's be open about that too. This is why I take that, those kind of things, or this is just a vitamin or whatever it is, you know? So I think just being be open about it. So another question from Facebook before I have a few other questions too. Where can people safely dispose of unused medications? Because, you know, they give you a prescription and they take like as needed with, you know, all this stuff. But a lot of times there's, especially with pain medicines, there's some left over. And we want to make sure we do things safely with those. So what do we do with unused medications?
I'll answer that one. So that's really easy. Most of the local police departments in Madison County, I know for sure, have drop boxes in them. Many pharmacies and hospitals also have drop boxes in them. They look a little bit like a mailbox, and they'll have instructions on how you use it. You can block off your personal information off of the pill bottle. You don't need to have that on there. You can rub that off with a permanent marker or unattach the label, or put your pills and medications in a baggie to drop off in there. You can bring them into the police station, no questions asked, put it right in the drop box. Those are available usually during lobby hours of your police departments, hospitals, and pharmacies. There's also events during the year that the DEA, the Drug Enforcement Agency, holds. They hold them in October and April. So just about the time we're changing our clocks for our new schedule, spring back, spring forward, fall back, you can take your medications in and drop them off at a DEA event that are near you, and you can look those things up online. You can Google them. But I do know that the police departments have that available free for you, and you can drop those off. I like to go through my medicine cabinet or any old vitamins. I know when my daughter came home from college, she had some vitamins that she planned to use and we didn't use them up. You can get rid of things like that. They don't accept some liquids and some puffers for asthma and injectable needles, just because of safety, and it's not contained well in those boxes that they have in their lobbies.
Right. So, and that's for any sort of medication. Doesn't have to be opioids, just any sort of medication, pills that you want to get rid of. And to find locations for the DEA Take Back events, you can go to takeback.dea.gov is where you would find locations for that. Okay, so why do you think that teenagers may be using substances? Why may teenagers be using opioids in general?
I think it's such a, you hear kids talk about it. There's a rebelliousness sometimes, a curiosity, even some kinds of fitting in. Might even be there's a mental illness thing developing, which I think played a role in mine at that age as my adolescent brain was hitting maturation there. But we've talked about it, us three before. The stressors on kids today, they're greater than ever. There's a lot of research out there. Instant grades. My daughter was just now writing a paper that's due at noon. She's not even supposed to go to school today, But when we were going to school, it was like, well, that's not till Monday when I see that teacher.
Right.
That's a small example, but we could go on and on about the phones and those stressors. And I do see elevated anxiety because of social media, because of the phone and fitting in and living up. And here comes this substance that may make you feel less criticized or less anxiety. And that's something we really need to watch and be engaged in with kids.
Yeah. And I mean, it's also a substance like kind of alcohol that's like it's available in your house in some cases, but also you don't smell it. It's not, you don't, when somebody uses an opioid, it's not like you can smell, it's not the same like as smelling marijuana on them or smelling alcohol in their breath. And it could be as easy as getting it from your medicine cabinet. So I think that's somewhat, readily available. And I do think that sometimes that, even adults don't understand the severity of opioid use. And so, my doctor gave it to me. So, if my doctor gave it to me, then it can't be that bad. So I think definitely there's been a lot of information out there about the opioid problem. So of course that's hopefully better. But yeah, I do definitely agree with the stress and anxiety that teens and adolescents go to. And sometimes they just want that instant gratification of feeling better. And unfortunately, that might be using substances.
And I will say it's a great point about medicine with parents. There's that lingering thought in many parents that I should save this one if a really bad pain moment happens for somebody.
Right.
I'm going to have this one there, and that is bad thinking. You'll be able to, if you're having really bad pain, it wouldn't be too long to hook up with a doctor, talk about it, and get to Walgreens, or whatever. But that thing of thinking you have it back there, I think that has allowed a lot of tinkering and experimentation.
Right. And I remember when I had my surgeries is like, trying, I'm like, oh, well, but what if I start, and within still the time
Me
period
too.
that it would be okay. But like, still,
Sure.
you were like, I don't want to be, I just took the last one or whatever. Do you think it was okay? Okay.
Mhm.
So I have a couple of Facebook questions. How can I start the conversation if I think my child is or has been experimenting with opioids?
Kristin, you want to do that one?
I think that it should start off with not blaming and not accusing, right? You want to maybe wait for one of those times when you're in the car together. A lot of casual
Yes.
conversations happen when, a kid is kind of half engaged doing something on their phone. And maybe you can say, hey, I've noticed that you're not hanging out with the same friends anymore, or I've noticed that some of these other things are happening. That would be a good way to start a conversation. If you're not sure of some of the signs and symptoms of a youth starting or engaging in experimenting with drugs, it might be a change in any of their behaviors. So a change in grades, a change in who they hang out with, a change in what their interests are. They might have some changes in their sleeping habits. Maybe they're very lethargic and tired acting, or maybe it's the opposite. Maybe they are showing symptoms of euphoria. You may not find anything in their room, and I don't necessarily suggest going out and searching in their room right away. I would start that conversation with them and remind them, well, I'm your parent and I'm concerned. And you can engage a health professional in that. You can contact the Chestnut assessment line, and that number is down in the chat, and they can help you assess if there is a need for treatment or a need for counseling. Hey, what's going on in your life that you might need to be, you feel like you're needing to be feeling anything except what's in your brain, right? That's why a lot of people use a substance. They don't like what's in their brain. There's stress in there. There's anxiety in there. I don't want that. I want to feel something else. I want it to be all blocked out, right? So just have those conversations. One website that I like to point people to is NIDA for teens. And that is teens.drugabuse.com, and that is giving information on a teen level. So things that they can understand, and signs and symptoms will be on that website, as well as things that they can explore or understand, right? So that's a good place to start if you have no understanding of what's going on.
Yeah, I would think I agree with all of that, and say, like, as a parent, just be nosy. Try it. Now my kids are a little bit on the younger side still. I mean, I have a 15-year-old, but like, just be nosy. Who are you hanging out with? What are you doing? How was school? All those kinds of things. And then, if you do think something is going, like, I'm concerned about you. And I love that Kristin was saying that she talked to her daughter in the car, because that's a great place. They can't go anywhere when you're in the car. So talking into the car is great.
We're going to go down to McDonald's for some French fries, and then you just start having a conversation. So what's up with your friends today? Or, hey, how are you doing? Yeah, prevention is worth its weight in gold. It really is. If you can have just daily contact, lots of contact with your kids at an earlier age, start building up that trust and communication. I think that's really important, but it still happens in families with, the best intentions, and it still happens in families who have great knowledge and have good communication skills and have, we exercise and we're healthy. So sometimes you need an outside opinion, you need outside help, and that is okay.
Yeah,
so
that's why
Paul,
you're here.
Yeah.
Huge.
So Paul, have you discussed these kind of things with your daughters? Like, are they aware of the struggles that you have had? And, do they feel open to talk to you about it and so forth?
Yes. Well, actually not till today, but they're in the other room listening, and now you outed me. No, they totally know. They totally know. And my situation might be a little rare just because I am so open about it. But I would say also, as parents, we kind of control the meals a lot. there's no food here, or, when's dinner? And if you've got a son or daughter that's missing meals, I know when I was taking pain medication, I wasn't as hungry. Some people are more hungry, but if you're noticing missed meals, that's something to take a look at. Also, I've noticed as a parent, something I'd never thought about as a kid or even a young adult, we're kind of like sometimes walking on eggshells in a way of we don't want that big blow up, like, hey, do you need to talk about substances? No, I would never do that,
Right.
And then they want you to take that as they said that a year ago, so I'm not going to bring it up again, And I think Kristin talked about that, less accusing and more communicating and being engaged, to the point of, it's a great question. Maybe there isn't the talk, like the, kind of the sex education, birds and bees talk. It's an ongoing engagement. Right. And even if you are a wine drinker, or alcohol, sometimes we think, oh, I do this, or maybe I had a moment that was bad with that, or back in my past, I probably shouldn't be talking about addiction and those type of things, but that's wrong as well. We're talking about, adult use of alcohol. And I know we'll get to this at some point in the next one, I think, but just because you're an alcohol drinker, we're talking about something completely different, underage alcohol drinker, or underage experimenting with substances. And as we know, it's such a different thing that happens to their bodies, but
absolutely. Their brains aren't fully developed till they're about age 25. So it's a completely different reaction in the body too.
Right.
Huge.
So
with those pathways.
Yeah. So that kind of leads me into my next question about how do opioids affect the brain, especially the developing brain? The brain is not fully developed to the mid-20s. So how could that affect it?
Well, our bodies all produce endorphins. Endorphins are like our natural good feeling chemicals. And they're created when we laugh or eat cheesecake, Allison, when we exercise, when we anticipate fun at a theme park, or we're like, watching our favorite superhero movie. These endorphins naturally block pain signals in our brain. Endorphins are a neurotransmitter. They're like a key, and it fits in a certain lock. And the shape of endorphins that are naturally occurring in our brain are very similar to the shape of opioids. So opioid painkillers or things like heroin are very similar looking to our neurotransmitters. That means that opioids can unlock areas of the brain that endorphins are intended for. The brain can't tell the difference. Both affect a person's emotional state and block pain. Endorphins are natural, so they don't cause harm, tolerance, withdrawal, or addiction, right? Those are natural. But opioids do alter activity in the limbic system in our brain that controls emotions. Opioids do slow breathing, which is controlled by our brainstem. And opioids do block the pain messages that are transmitted down our spinal cord and to the rest of our body, right? So those things occur faster or more easily in the youth brain, right? The youth brain is still forming all these different pathways, right? Kind of like when you're an awkward toddler and the little toddlers walk like Frankenstein. And then by the time they're, school aged, hopefully they're walking and running just fine, right? They have their motor skills down. Well, the body gets more and more fine-tuned as we get older, right? So if we're hitting it at an earlier age with any altering substance, it can damage some of those pathways in the brain. It can slow development of the brain, and it can do a lot of damage.
Yeah, I think about, because we've talked about how I get endorphins from cheesecake, and then I'm thinking like, but how would you feel if the only time I felt happy was when I was eating cheesecake? Like that, and which is not true for everyone, I happy other
sure.
times. But that's similar, like, because there's people who can have an addiction to food and stuff like that. But like, just think about like, you get those feel good feelings, but the only time that you have those feel good is when you're taking the substance.
Huge. I think that's kind of right off of what Kristin's saying about the effect on the brain. Like, say you're building a maze, the developing brain building a maze, and then you drop a ball in the middle of that clay or whatever you're building. you're affecting that maze that's being made. It's not as clear. And with an adult, maybe the maze is already made, still in effect, but with kids, it's so very different. I think that's a great point though, Alison. It affects the brain. It does these things. It rewires the brain. Then it puts you on the path of, without it, you feel gloomy, you feel blue, you feel scared. And once you get on that path, it is difficult to get off. It's not impossible. Look at me or many others, but it's somewhat rare. And you want to make sure your son or daughter doesn't have that challenge coming up, in their life to deal with for their whole life. Once you rewire it, there's that moment of just malaise, or many moments of, this moment could be better. You know what? If I had 10 hydrocodone, or, I know that was a big thing with me early on, was the belief that the moment could be better now with a substance. And that's so dangerous.
Right, for sure. We had another question from Facebook, and I'm going to see if Kristin can answer this, but we might have to answer this later in the chat. So if we ever answer a question, we will comment back in the Facebook. What are some possible indicators that children are being endangered by parents or guardians who have an opiate disorder?
Okay. That's a good question. That's a tough subject area, and I'm glad that somebody is watching out for a youth out there. I would suggest that if you think it could be occurring, that you should document what you observe and when you observe it, and you should contact some mental health professionals or the school administrators where the child goes. You should contact the police or DCFS. I do not have a background in child neglect or child abuse, right? I do prevention work. So I would really suggest contacting some professionals that can answer that question really well. I believe that you could call SAMHSA's 24-hour line, because they're versed in mental health and addiction information. And you can also call Chestnut, because there are lots of options and services available through Chestnut. So if I haven't answered you, I'm really sorry out there. And we can try to provide more information in the chat at a later date.
Well, no, yeah, I think that was great, because of course we are thankful that there's people who are watching the children, but that is a huge thing too, is the children being affected by maybe adults that have an opioid disorder or any sort of substance use disorder. So it's very important, to try to get the help that you need. I think that what Kristin said was great too. The numbers that we had, when you see a child going through that, it's very difficult, but it's good that there are people out there who can help. And even if that child isn't using substances themselves or anything, that is still help for they may need some counseling and those kind of things.
And I want to add in from the perspective that you have me here for, the misuse. We believe we are performing better. The person who is dealing with addiction or a high tolerance, we think we're performing better. I actually thought I drove a little better, in some ways, and driving is probably a big part of your question. And, sometimes you need to talk to that person, and say, I've noticed this or that, if it's not going to endanger you or the kid, you need to let them know. They might not be aware of it. They might think nobody knows, I'm just moving a chick. I'm a busy mom and that's my little helper, So I think that's really important to let them know. But you guys at Chestnut are just so amazing with all of your resources. So there's many answers to that question, all of them very useful with you guys.
Well, and I would say, no parent is wanting to hurt their child. If they have a substance use disorder, it is a disease, and it's something out of their control. It's good to see that we have people like Paul who have gone through it and are on the other side and can say, like, there is hope. There is there is recovery and all of those kinds of things. You can have success and family and all that sort of stuff after that you've gone through this time in your life. So we're about out of time. If you can believe it, it went pretty quick.
Yes.
Before we close up, is there any last things that either one of you would like to say?
Yeah, absolutely. Just to remind people, if they or a loved one is experiencing a problem, please reach out as a first step to get an assessment. You can contact Chestnut Health Systems in the St. Louis Metro East area at 618-877-4420. Chestnut also serves other areas in Illinois, so go ahead and look in the chat for those phone numbers. And then the SAMHSA National Helpline is 1-800-662-HELP or 1-800-662-4357. I think that this is an important topic, and I wish we could go on forever. So Thank you. Thank you, Paul.
Yeah, thank you. Me too. I feel that as well. And I would also add in the modeling, just a reminder that even though it may seem like your son or daughter is just over you, but the teen, they are watching you. More is caught than is taught. And they are looking at how you handle stress, how you handle celebration or anxiety, whether you know it or not. And the studies show they would love to know your opinion on substance abuse or drug prevention. They're interested in that, whether they act like it or not. So if we can model in a way that says, maybe I don't need a pill for everything, and I've been there, if we can model that, it just goes a long way.
Yeah, for sure. I want to thank both Kristin and Paul for coming on here with us, and all of you who were watching on Facebook. A recording of this will appear on the Chestnut Facebook page, and watch for another Facebook event. And remember that those resources are available. So I thank you guys all for joining us, and I hope you guys have a great rest of your Thursday.
Thank you. Bye-bye, guys.
I was like, I think she's off.
Yep, you guys are good.
There she is.